Hello everyone, I am Dr. Santosh Kumar, Orthopedic and Joint Replacement Surgeon based in Kolkata, West Bengal, India. It has been my continuous endeavor to bring the world's best and the most safest in orthopedic and joint replacement surgery to right here in the city of joy in Kolkata, and I welcome you all from all over the globe. Whenever you need an orthopedic and joint replacement surgery, please come to us in Kolkata. We will give you the best, the safest and at the most affordable and the most reasonable price. We have a vast expertise of more than 10,000 joint replacement inclusive of all hip and knee, and we have been doing both sides simultaneously in the same sitting for very long time, and we have immense expertise in that also. So before this, in various series we have discussed about knee replacement, hip replacement and all those factors, and whenever I have been seeing patients for a long time now of hip and knee replacement, especially in hip replacement. Many patients tend to be younger patients. They are highly internet savvy, they do lot of research, lot of reading, and they ask about many things. So we have been trying to answer their questions in the various series that we have done previously. We have seen about what is hip replacement, what is hip arthritis, what are the various types of hip arthritis, when one needs a hip replacement, what are the types of hip replacement. We have already seen all those things. This present talk is about something called dual mobility hip replacement. Now this I am doing it because I get a lot of queries on that. People read on the internet about that and they ask me and they demand dual mobility hip replacement. So that's why I am doing it. But before that, I must say one thing, that joint replacement, whether it be hip replacement, knee replacement or any other orthopedic or any other surgery, is completely precision and technique based. What it means is that the most important thing which determines the results after a joint replacement surgery, the longevity of the implant, is the technique, the precision with which it is done. So precision includes the mechanical factors like the sizing, the millimeters, the degrees of placement of the components in various planes, like this is one plane, this is one plane. So there is something called inclination, there is something called version, there is something called tension and adequate tissue tensioning, adequate soft tissue tensioning. So all these things are more important than the design of the implant. Whether it be a cemented hip replacement, uncemented hip replacement, whether it be large head, small head, whether it be single mobility, whether it be dual mobility hip replacement, whatever may it be, the results will be good in hands of good surgeon and good surgeon only. What it means is that the surgery has to be done properly, hence the results depend on the surgeon, and it's not something like that you buy a commodity from market and then you get the best thing like an electronic item. It's not like that. But anyway, since a lot of people do ask about dual mobility hip replacement, we are here to discuss. So before that, we just have a quick look at what is hip arthritis. Like this is a hip joint, this is the hip joint. Hip joint is the junction between the pelvis and the femur bone. That is the pelvis and the thigh bone. So there is a ball and socket joint, there is a ball, there is a cup. So this is the head of femur and the acetabulum. So this is a joint, ball and cup joint. And in arthritis, this joint gets destroyed. In the ball and cup interface, there is a cushion called cartilage, and this cartilage wears out, which is known as arthritis. This causes arthritis. So the basic preliminary investigation for any arthritis is an X-ray. Although we can do an MRI, which we can detect things earlier in an MRI, especially in avascular necrosis and things like tubercular arthritis, where MRI can detect the pathology much before an X-ray can detect. So we will see MRI and all this in another talk. Today we will focus on the dual mobility cup. And in X-ray, what we see in the X-ray. So in X-ray, here we can see the left side has got an arthritic hip. The joint space is reduced. There is excessive whitening, which is sclerosis, and the ball has started moving outwards. So that is known as subluxation. And here the right side is okay. So similar X-ray in which we can make out hip arthritis. Similar X-ray in which there is a very advanced hip arthritis on the left side. I hope we can make out that right side is nearly normal and left side there is advanced hip arthritis. So various techniques that we have for hip arthritis technique, the various joint replacements and all include, there is something called total hip replacement, which is the gold standard which we have been doing. There is hip arthroscopy, there is hip resurfacing, and then there is if sometimes the implant needs to be changed, because of several years or some wear and tear or something, we can again rechange it and redo it. That is known as revision hip replacement. That is known as revision hip replacement. So basically what we do in hip replacement, the diseased ball in cup mechanism, the diseased head of the femur and the cup is replaced by a new head and cup, that is known as the hip replacement. So this is how it looks like inside the bone. The hip replacement has got a stem which goes inside the femur bone, and this is the head of the ball of the joint, and there is a cup. So this is what a hip replacement looks like. So in previous series we have seen what is large head hip replacement, what is cemented, what is uncemented hip replacement. We have already discussed all those things. So the present talk is about dual mobility hip replacement. Now as we saw in the previous talks that the hip replacement, the component, the design, the implant consists of three parts. One, there is a cup, second there is a ball, and third there is a stem, which we have already seen. There is a cup, there is a ball, there is a stem. The ball, the head has got two bearings. That means there is a small ball, the blue color, and which is either metallic or ceramic. On top of that there is another umbrella like ball which is locked and paired with that is known as the outer head, the outer bearing surface, and that together is put inside a metallic cup. So this is known as dual mobility hip. And to understand it better, let's see this. There is a head which is the inner head. It is made up of either ceramic or cobalt chromium alloy. On top of that is paired with a revolving head made up of polyethylene, that is plastic, the ultra high molecular weight polyethylene, and this is together put inside the cup. So in conventional hip replacement, this polyethylene used to be with the cup and the head used to be alone. But in this case, the polyethylene is paired with the head itself, and together this thing is put in the cup, and the cup is devoid of any polyethylene, and that is only the metallic part, which is either cobalt chrome titanium or tantalum. And outside is porous coated, calcium hydroxyapatite coated, so that bone ingrows on that, and that causes a press fit at the time of surgery. So just having a look at the picture, how it looks like. It looks like something like this, wherein this is the cup, outer cup, which is a metallic one made up of tantalum, titanium or cobalt chromium. This is porous fitted for immediate press fit, friction fit, and bone ingrows on that, and inside that is the dual mobility hip. So the dual mobility hip, the dual mobility head comes in all these designs. The inner head can be ceramic looking pink in color. It can be metallic cobalt chromium alloy, which is blackish grayish highly shining alloy, and on top of that there is on the inside head, the outer cover, outer umbrella, the outer head is made up of ultra high molecular weight polyethylene, which looks either whitish or yellowish in color, and that together is put inside the cup. So this is the dual mobility cup. Just having a look, this is how it looks like. This is the inner head, which is made up of ceramic here. It can be cobalt chrome. In my opinion, ceramic and cobalt chrome both are equally good. There is no difference. There is almost no difference between them. Both of them are used because they can give highly polished, highly smooth surface. So cobalt chrome can also give a highly smooth surface. Ceramic can also give a highly smooth surface. So on top of that, there is a ultra high molecular weight polyethylene head, which is paired with that, and that whole is put inside the cup. Just have a look. This is the outer cup which is put inside the acetabulum. This is the cup. In the conventional hip replacement, this cup used to be covered with a plastic liner which is made up of ultra high molecular weight polyethylene. But in this dual mobility, the plastic liner, instead of being paired with the cup, it is being paired with the head itself, and that gives 2 degrees of movement, 2 degrees of freedom of movement. So that increases the size of the head immensely, and that gives many advantages when the head size increases. So when the head size increases, the range of movement increases immensely. That gives a solid protection against any dislocation, especially in people who are having weak muscles or neurologically impaired musculature, or sometimes in case of fracture where there can be bone deficit, muscle injury, or there can be laxity in muscles. So in those cases, dual mobility hip provides more stability because the size of the head is large. So this is how dual mobility looks like, just as we explained, and this is the big picture. This is the inner head. This is the inner head. It is covered by an outer umbrella like this is the outer head is paired with inner head. It is paired with inner head. So there is one movement which takes place at inner head and the outer head interface, and there is second movement which takes place at the outer head and the cup interface. So there are 2 degrees of movement which gives a more wider range of movement. There are 2 degrees of movement, 2 coordinates of movement. So this is how it looks like in X-ray, and a person after hip replacement can do jogging and all, everything. This is how normal hip replacement looks in X-ray. Left side you can see this is how it looks. So now nowadays this dual mobility cup and this systems are also used in revision hip replacement. What revision hip replacement means is that wherever the there has already been an hip replacement over several years, and then it has to be changed to a new one, that is known as revision hip replacement. So that can that mostly occurs if hip replacement has been there for several years, 25, 30 years, 40 years, and then it has to be changed to a new one. In that case, it is known as revision hip replacement. Or sometimes in cases of fracture where special implants are used, in those cases we use special cups which are known as revision cups. It has got more fixation options, more options to deal with intraoperatively. So how a dual mobility is better than the conventional hip replacement? In conventional hip replacement, as the leg moves, for example, it moves this way or this way, the neck goes and hinges with the cup, and sometimes it can make it jump. So that jump height is drastically decreased because there are 2 degrees of movement in dual mobility. Once the inner head stops moving, the outer head starts moving. So because of the greatly increased diameter of the head cumulatively, there is much wider range of movement. There is much wider range of movement with immense stability. So this special dual mobility cups are also used in cases of revision or trauma, fractures or tumors, wherever multiple options are there in head and the neck. The stem has got 2 options. One is proximally coated and another one is fully coated. Both of them are equally good. There is no difference in that. Again, we will just have a look how dual mobility is superior. So this is the conventional hip replacement. This is the conventional hip replacement where there is a ball. Where is the ball, and the plastic is locked with the cup. The plastic is known as the liner. It is locked with the cup, and there is only 1 degree of movement. So it moves like this. Now in this one, the plastic is locked with the head. That increases the diameter of head immensely, and it gives 2 degrees of movement. One, the inner ball moves inside the outer head, the inner head moves inside the outer head, and then once it finishes moving, the outer head starts moving inside the cup. So that tremendously increases the range of movement, and it tremendously increases the stability. So a person after hip replacement, normally we lot of cases wherein both sides hip replacements are needed, we normally do both hip replacements in single sitting, or of course it can be done in 2 sittings separated by few days or few months or years even. So what we mean is that if there is requirement of hip replacements on both sides, then it can be done together in single sitting if the person is medically fit. We had a patient who had hip replacement in single sitting on both sides, and he walks immediately the next day of surgery. Normally after hip replacement, we make the person walk from the very next day of surgery. We use a walker for first 8 or 10 days, and after that we use a stick for another 8 to 10 days, and within month to 1.5 months the person starts walking without any support, and by 2 to 3 months person can start running, person can sit on ground, person can sit cross-legged. All those things can be done with large head hip replacement or dual mobility hip replacement. Another thing that I insisted initially, that most important thing for a hip replacement or any other joint replacement is precision. The precision with which the cup is put, the angle in which it is put, the plane in which it is put, the measurement, the tensioning. These are the factors which determine the results, the precision, and we get enhanced precision by use of orthopilot navigation. We also use orthopilot navigation, so that gives a much enhanced precision, and the placement component placement is improved, and that gives better results. In nowadays with dual mobility hip, person can engage in sports also after dual mobility hip. So just now we had a discussion about hip replacement, one of the models of hip replacement, which is dual mobility. But let me clarify again and again that the standard hip replacement with large head is equally good as dual mobility hip. Dual mobility hip is one way beneficial in younger patients, but it is more useful in people with neurological weakness, muscle weakness. And let me again tell you, the most important factor for which affects the results and longevity of the implant, and which affects the results of surgery, which affects the outcome of the surgery, the most important factor is the surgical precision, the technique, and that is completely dependent on the surgeon. So if I have to choose hip replacement, I have to choose my surgeon, not my implant. The most important thing is to choose your surgeon. A good surgeon can give very good results in any form of implant, whether it be cemented, uncemented, whether it be single mobility, dual mobility. So it all depends on the surgical technique, surgical skills, expertise, and the experience of the surgeon. We in Kolkata here, our endeavor is to bring the world's best in joint replacement and orthopedic surgery to you in Kolkata, and I invite people from all over the world, all over the globe, all over the nation and neighboring countries to come to Kolkata. We will give you the best, the safest at the most affordable prices, and we will help you in all possible ways so that you can resume your normal activities, normal life. You can enjoy the freedom of movement, and we are committed to restore the joy of movement. Thank you.